So I'm going to go out on a limb here and say that everyone in this class has participated in or at least heard of the DARE program. It was started in 1983, so Rick, Jason, I apologize, you guys are going to have to live vicariously through your kids. Today, it's no secret that cigarette use and tobacco products are dangerous and have harmful side effects. I remember growing up in Arizona, there was a campaign, and it had this catchy slogan at the end. It was tobacco, the tumor-causing, teeth-staining, smelling, puking habit. That campaign launched in 1996, so clearly it stuck. Now today, there's a more glamorous way to smoke, or as people say, vape, through the use of electronic cigarettes. As a healthcare provider, it's going to be important to stay up to date on technologies, medications, and of course, the latest health trends. With growing popularity in electronic cigarette use, you're going to have patients who come to you asking about something they've heard, something they've seen, or maybe even something that they're curious about trying. And it's going to be important that you as the provider are able to provide and counsel the patient with correct information. In our rotation, we realized many members of our group thought, wow, when a patient would come in and ask us about electronic cigarettes, we'd think, wow, great question, I actually don't know. So we took a small sample from the class of 2016 and the class of 2018 here at USC and asked them some of the most basic electronic cigarette questions, and these were their responses.
What do you know about e-cigs?
What do I know about them? They're like, I don't really know much about that.
It's supposed to be healthier for you.
It's an alternative method of smoking.
Would you feel comfortable counseling a patient on the usage of e-cigs?
No.
Perhaps it's better than, I don't know. At this point in time, no. But if I had more information, yes.
So we realized that there was kind of a gap in our curriculum and our knowledge of this new growing health trend. So our group decided to focus on the USC PA class of 2018, and we created an educational video and also an electronic book to provide them with the quick and dirty facts about electronic cigarette use. Polly, give me a number. What % of teenagers do you think are smoking e-cigs nowadays?
I would say super low, like 3.
Close, but no cigar. In 2013, 4.5% of teenagers had tried electronic cigarettes at least once. Compared to 2014, 14.5% of teenagers had tried electronic cigarettes. That's a pretty big increase in just 1 year. So, we all know that electronic cigarettes are shown to aid in traditional smoking cessation because of the lack of tobacco. However, I don't think these teenagers are really vaping for that reason. Vaping is cool, right? But is it cool that the nicotine inside electronic cigarettes is shown to impair lung and brain development in fetuses? Is it cool that the nicotine inside electronic cigarettes is also shown to impair hippocampal and cerebral cortex development in these teenagers smoking the electronic cigarettes? No, it's not cool. But the media is focusing on the fact that these e-cigs don't have tobacco, and there's all these different flavors, and so they're neglecting the fact that we don't know the long-term side effects of nicotine use inside these e-cigs. Healthy People 2020 is calling physician assistants to action. They're saying we need to focus on matters such as health promotion and disease prevention, and environmental factors such as tobacco and electronic cigarette use. As you saw in the video, we noticed a huge gap in our curriculum, and we are trying to bridge that gap by providing providers with this electronic information. So, we also found trends in the UK, and so we decided to focus on SPAs 4 and 5 in this area so we can focus on a specific population and bridge the gap in that area and further define their needs. We noticed higher tobacco use, higher lung mortality, and lower higher education in these areas. So, we would like to teach the teachers and help bridge that gap so we can fill the need in this community.
So how do we relay this to our patients? So many PAs are unaware of the basic knowledge of e-cigarettes, and so using the teach-to-teacher method, we sought out to teach PA students or future providers about electronic cigarettes because many of them were lacking the knowledge. So during our intervention, we asked PA students questions such as what is e-cigarette or what is e-juice? And many of them at pre-test didn't know what e-cigarette juice is. Their answers were very vague, very broad. And after intervention at post-test, their answers significantly improved and were more uniform and showed increased knowledge of the subject. We also asked them things like, do you feel comfortable counseling your patients about e-cigarette use? And the majority of them said no, they don't. So this is kind of the point of our project, right? We want to make sure that the people who are supposed to be counseling their patients about a particular topic actually know about the topic. So when they tell us that they don't know, or they don't feel comfortable or confident counseling their patients, then that kind of proves the point why we want to do this project and seek this intervention. So like we already mentioned, we've also created an ebook to provide key points, key pearls that providers can use or can be distributed to providers and patients in order to help increase the patient knowledge. And in regards to cultural competency, so normally when we talk about cultural competency, you talk about educating a very diverse, very multicultural patient population. For us, however, we didn't really talk to any patients at all, much less a diverse patient population. But what we did do was we spoke with a diverse, multicultural student population, and we taught them about electronic cigarettes, and excuse me, and we also use our ebook to help bolster our cultural competency by it's only currently printed in English, and it will be printed. It can be printed or translated in any language. So what we hope to do is we taught our information to a diverse student population in hopes that, or with the aspirations that they would be able to understand our topic fully and be able to translate or relay that information to their future patients who we expect or anticipate to be patients of a more diverse, multicultural background.
So when we originally got together and started discussing ideas for our project, it became immediately clear that advocacy was our primary concern. We thought about advocating for better teen education in a variety of subjects, and we also thought about advocating for better education in current health topics. Then we remembered what Saba and Ms. Maldonado said about keeping it simple, keeping it small. So we thought to ourselves, how could we reach out to the largest number of people or how could we reach out to the smallest number of people but have the largest impact? Basically, like everyone said, how could we teach the teachers? So that's when we decided to educate the class of 2018 regarding the use of electronic cigarettes. As some might be aware, the average PA sees around 80 patients a week. So if we could reach out to the 60 students in the class of 2018, so we could effectively, therefore, reach out to their future patients right around 4,800 per week. So our first step was to speak to the Director of Didactic Education, Ms. Whitehorse. We had a nice conversation with her. She was really receptive and allowed us to speak to the class of 2018. So on the day of the presentation, we spoke to the class of 2018, and as you will see in our pre and post-test results, our project was significantly valuable, and they did learn a lot. But also, more importantly, in our post-presentation group meeting, it was unanimously decided that not only did we reach out and advocate for the class of 2018's education, but we were also advocating for their future patients.
So I'll be talking to you about the actual results that we saw both before and after our interventional video. I went ahead and chose 4 questions out of the 10 that we gave the students, just so we can give you a brief overview. So first couple of questions that we asked the students were, what are the risks and benefits of smoking e-cigarettes? And we allowed them to type in their answers, so it was free text. And as you can see, answers were all over the board. There was a large variety, a large percentage of other sections in both of these questions. So for the risks, you saw answers similar to cigarettes, like cancer, lung disease, things like that. And for benefits, once again, large variety, but we also saw inaccurate answers, like there's no nicotine or there are no benefits. So we wanted to help fix that. And as you can see after our interventional video, less variety, more uniformity. What we didn't expect were for the students to latch onto mechanical hazards. That seems to be something that they all kind of focused on. which is fair because during our video, we did show some graphical pictures of e-cigarettes blowing up on people's faces, so that could be a reason for that. And for the benefits, once again, more uniformity, and these are actually correct answers now, like it helps in smoking cessation, and it helps in cost effectiveness. So we helped in that aspect. For two other questions that we focused on were, how do the students feel in counseling patients about e-cigarettes? Didn't expect most of them to not be comfortable at all in counseling, so we wanted to help fix that. And we asked them about some common terminology like what is e-juice? Once again, majority didn't know what that meant. So after we showed the video, we were very happy that 4% now were not comfortable in talking to patients. So that is something that we did predict and something that we're very happy about. And as you can see, we got 100% of them to correctly answer what is e-juice. I think that's always unexpected when you get 100%, but we're also very happy about that.
The overall intent of our intervention was to educate current physician assistant students on the risks and benefits associated with e-cigarette usage, while also increasing their awareness of vocabulary and frequently used terms, and ultimately enabling them to counsel future patients on e-cigarette usage, specifically within LA County. Now, as previously stated, our objectives were successfully met. Now, that doesn't go to say that we didn't have some limitations and barriers to encounter. One of those being our sample size. Our sample size actually altered from our post-test and our pre-test, with our pre-test being about 50 responses and our post-test being about 47 to 48 responses per question. Now, excuse me. Now, had we actually selected a program that allowed for each respondent to make a mandatory response for each question, then we wouldn't have any of this attrition rate or some of the questions being skipped, therefore increasing the ultimate or the significance of our study. Now, additionally, looking at our actual population, we only looked at USC PA students, and we only specifically looked at the class of 2018. Now, maybe we could possibly expand the scope of our study and to go to Western, although they may not be as smart as us, they may be able to answer some questions. Or we could possibly expand to the class of 2017 or even our class. Now, also looking at our participants of our study, our respondents, we did not screen them. We actually, it was a completely randomized study. Therefore, we're not exactly sure, maybe they worked in a smoke shop on the weekends, maybe they smoke every day. You just never know. So in future application of this particular intervention, we could possibly stratify our participants. Now, speaking of actual future application of this particular program, because of the fact that, the information about e-cigarettes is constantly changing, this particular program may not be as relevant within the next 1 to 2 years. Therefore, I encourage future students who participate in this particular course to make sure to expand upon the knowledge that we have presented today.
So in conclusion, while our sample size was small, we can see from the data that we did have an impact on improving the understanding of e-cigarettes. We were able to empower these students to counsel patients regarding the risk and benefits using appropriate terminology for e-cigarettes. We were also able to, we found a lot of interest in this topic. As we went out with our needs assessment, we found a lot of people who wanted to know more. Many of you even expressed an interest and desire in learning more about our presentation. Unfortunately, we weren't able to include the class of 2016 in this project, but we will have the video available and the electronic book that we can share with each of you, all who are interested. And one thing that we wish we could have improved upon, while our video was successful, it's not a medium that lends itself very easily to updating. Maybe something like a website could have allowed us to update it and keep it up to date with the latest information. As this topic changes, as new information becomes more available, we could update it more readily. However, a presentation of this type could easily be replicated and implemented into a PA program in the future. This is a topic that, as PA students, we need to be on the cutting edge of medical knowledge. We need to be able to have the latest information to share with patients. And PA programs should be able to keep their students up to date on the latest information, especially e-cigarettes, to be able to counsel patients and fill them in on the latest. So thank you for your time.